All right, another story that is gaining traction in news coverage is a long COVID, right? And here I'm going to be sharing again from the CDC official page on a long COVID basics. So what are the key points when it comes to long COVID? Long COVID is a serious illness that can result in chronic conditions requiring comprehensive care. Long COVID can include a wide range of ongoing symptoms and conditions that can last weeks, months, or even years after COVID-19 illness. Anyone who had a SARS-CoV-2 infection, the virus that causes COVID-19 can experience long COVID, including children. COVID-19 vaccination is the best available tool to prevent long COVID. Living with long COVID can be difficult and isolating, especially when there are no immediate answers or solutions. So what does the CDC know about long COVID? Long COVID is a chronic condition that occurs after SARS-CoV-2 infection and is present for at least 3 months. Long COVID includes a wide range of symptoms or conditions that may improve, worsen, or be ongoing. Anyone can get long COVID, right? Long COVID occurs most often in people who had severe COVID-19 illness, but anyone who gets COVID-19 can experience it, including children. Who is at risk? While anyone who gets COVID-19 can develop long COVID, studies have shown that some groups of people are more likely to develop a long COVID than others, including, and this is not a comprehensive list, but they're saying including women, Hispanic and Latino people, people who have experienced more severe COVID-19 illness, especially those who were hospitalized or needed intensive care, people with underlying health conditions, and adults who are 65 years or older, and people who did not get a COVID-19 vaccine. So how can you prevent long COVID? CDC emphasizes core strategies to lower the risk from COVID-19, including severe outcomes such as hospitalization and death. Preventing severe outcomes from COVID-19 illness helps prevent long COVID. Steps you can take to protect yourself and others include staying up to date on COVID-19 vaccination, practicing good hygiene, practices like hand washing that improves cleanliness, taking steps for cleaner air. When you have a respiratory virus, use precautions to prevent the spread and seek healthcare promptly for testing and/or treatment if you have risk factors for severe illness. Treatment may help lower your risk of severe illness. And I want to see what else I can share in context to call the long COVID here. I think what I should be looking for are, let me see if I can find the signs and symptoms of long COVID. Just give me a second. All right. So the neurological symptoms that you can experience when you have long COVID are difficulty thinking or concentrating, sometimes referred to as brain fog. You may get headaches, you may get sleep problems, you may get dizzy when you stand up, being a little lightheaded. You may feel pins and needles, change in smell or taste, and you might be depressed or anxious. All right. So these are just some of the tips that I have to share, the information that I found regarding long COVID, which is a story that I keep seeing, picking up traction in health news coverage. So again, thank you, my friend, for watching, and I hope you're having a lovely day. And most importantly, I hope you're having a healthier day wherever you are.